Okay, this video demonstration is going to show you how to do a home drug test. Home drug tests have been available for purchase from specialist internet retailers for well in excess of between 10 and 15 years now in the UK. So the ability to buy both a single drug test just to look for a specific drug group such as a cannabis test or an opiate test or an amphetamine or cocaine test is there for you to take, and you can also buy these in what are called multi-panel tests, which are basically a combination of different drug groups bundled together onto a panel test, which basically dips into a sample and will give you individual results for the group of drugs that's bundled together on the panel. So you can, in a single test, perform a drug screen from a single drug group right the way up to a 10 or even a 12 batch of different drugs with individual and very accurate results for each. Now, when you're deciding to do a home drug test, first choice you've got to make is whether you're going to conduct a urine test or a saliva test. The product we're going to demonstrate for you here is a urine test product. Now, many people, when they think about it, they're not particularly keen on going down the urine route. They think it's messy, they think it's going to smell, they don't want to handle it, and they certainly don't want to collect it. But there are certain advantages when you're looking at home drug testing to considering going down the urine route as opposed to the saliva route. And the principal one is the detection window periods that you've got for the drugs that you're going to look for. Now, on a urine test, you are looking at usually between 3 and 5 days after somebody's used a drug that it will still be detectable in urine. If you compare this to a comparable saliva test, you can be looking at anything from 12 hours up to a maximum of 3 days. So the window is extended by going down the urine route. You will pick up more, you'll detect it over a longer period of time, and if you want to screen to exclude any drug exposure at all, a urine product testing performed twice weekly on a semi-random basis, Monday and a Thursday, Tuesday and a Friday. Basically, by doing that sort of a routine, you're going to exclude any exposure to drugs during the course of a 7-day week. So what we're going to do now is move and show you just the procedure for running this simple test. This is a single test that we're going to show you. It's a Core Test brand of drugs of abuse screen. These are sold as home drug tests and professional drug tests. The quality, accuracy, specificity and sensitivity is identical between whether you buy a home test or a professional test. Okay, so here is the Core Test taken out of the foil pouch. And what you get when you open it up is one of these little pipettes. You take 3 drops of a sample into the sample well, and you will see almost immediately that pinkish dye starting to travel up that centre well where you're going to get your results window. If I just show you, on this cassette design you're going to have some coding shown in this window which basically will confirm the drug group that you're testing for. THC is tetrahydrocannabinols, that's the cannabis test this one is looking for. And these tests screen for cannabis in the sample. This is a urine sample test at 50 nanograms and above. So if there's cannabis being exposed in the person that's given this urine sample, you are going to get a positive result if they've got cannabis coming out of their urine samples at 50 nanograms or above. Now that's a tiny amount. Nanogram, that's 10 to the power of 9. It's a very, very small quantity of cannabis. But that level's been chosen for a very good reason, and that's that it's been shown that it is almost impossible to passively absorb cannabis at above that level, even if you're in a crowded, smoke-filled room for a long period of time. So they've picked 50 nanograms for a urine cut-off to basically mitigate anybody using an excuse of passive inhalation for why they're showing positive on a test. To get to 50 nanograms or above, you really do have to have actually used cannabis, and you would expect that to remain positive between 3 and 5 days after a single cannabis use. If somebody had been using high concentration cannabis or over a long period of time, then cannabis could still be detectable in their system after they stop using for anything up to 28 days. So here we can see on this test you've got a control line showing here, which is nearest the coding end, and you've got a test line showing here, much fainter in this case, but this is within 2 to 3 minutes of the urine sample being added. Where you've got a test line and control line, there's no drug present in the sample and this is a negative test result. Doesn't matter if the test line's thinner or fainter than the control, if both are present, as soon as you can see them, negative result. Don't try and interpret anything into the test line, colour, saturation, density or thickness. If it forms with a control line, negative. If there is no test line showing at 10 minutes, that's a positive result. So to get and read with accuracy a positive result for cannabis, you do have to wait for this to develop for the full 10 minutes. So that is very simple, easy process. I've just shown you how to perform a home screen to detect presence or use of cannabis in somebody that's produced that sample for you. Over the previous 3 to 5 days, if they'd had any cannabis, then we'd expect that to show a positive result. And the accuracy of these tests, you're running them at home, 99% accurate. So very reliable, easy way to exclude all your negative results. Very easy, quick and simple to perform.